simply because they don't know what their public health budgets are. Does the Minister think this is acceptable?
No, and that's why I've just announced that every local authority will see a real terms increase in their grant allocation, so that doesn't have to happen.
We now come to Vicky Fox.
Thank you, Mr. Speaker. Between 2017 and 2020, the government has cut nearly £4 million from Lewisham Council's public health grant. The public health team is facing many challenges, not least from coronavirus. Now, what does the Secretary of State mean when he says imminently? Because councils need, to have this security. And given the pressure that local teams are under, will the Secretary of State look to restore funding to 2010 levels in line with population growth and inflation?
Well, as I say, every local authority will see real terms increases in their allocation, and by imminent I mean in the next couple of days.
Thank you, Mr. Speaker. The Secretary of State keeps saying that local authorities don't need to worry about any of this, as the government have said they will be giving local authorities more money. Well, I asked my local authority on Friday if that reassured them, and surprise, surprise, it didn't. That's because more can mean anything. Is it a penny more? Is it a pound more? Is it £100 more? Is it £1 million more? Bit of a difference. So, when will you let them know? You've now said imminently means a couple of days' time. Exactly what are you waiting for? Is it the budget?
As I say, the good news is that local authorities can all plan with confidence that these budgets are going up in real terms, and the exact details will be set out imminently.
Traditionally, public health used to be about infectious diseases and sanitation. More recently, it's become about lifestyle issues. Given the epidemics of the 21st century, and particularly COVID-19, what measures will the Secretary of State be taking in allocating the public health grant to refocus on infectious diseases current and those that are likely to come?
This is an incredibly important question, and one that we'll be addressing in the run-up to the spending review. The truth is that the public health grant is but one small part of the overall effort of local authorities to improve the health of the residents who they serve. And although it's an important part, and it's good that it's going up in real terms for every single local authority, we've clearly got to ensure that the whole effort of a local authority is there to improve public health.
Mr. Speaker, all the evidence suggests that coronavirus is of greatest risk to those who are older in our population. My constituency is an average age 10 years above the national average, and yet when it comes to public health allocations, Cumbria only gets £36 per head, as opposed to £63 a head as a national average, £100 per head for public health in many parts of London. Does he agree with me that that is a dangerous inequality, and will he fix that in the upcoming statement?
Well, it's the inequalities in health outcomes that I'm particularly concerned about, and in particular in terms of the length of healthy life expectancy, which is of course affected by both communicable and non-communicable diseases, and the public health around both of these important considerations, and the wider issues that my right honourable friend just mentioned. So we'll take all of this into account as we look at how the public health grant is best allocated and best used ahead of the spending review.
Desmond Swain.
Number 2, sir.
With your permission, Mr. Speaker, I'll answer questions 2 and 5 together. We're creating an extra 50 million appointments a year in primary care. We're growing the workforce by some 6,000 more GPs and 26,000 other clinical staff on the front line. We're encouraging everyone to think pharmacy first, so that access to the right healthcare professional is there when you need it.
Sir Desmond.
And will patients notice the difference?
I thank my right honourable friend. Shortly. I would firstly like to just whip over the statistics. In December, there were nearly 400 more nurses, there were 200 more doctors, there were 1,000 more other staff providing patient care in primary care than a year earlier. By encouraging recruitment, retention, minimising unnecessary bureaucracy, This will help primary care support the patients in the most appropriate way and ensure everyone has faster access to appointments sooner. If you would indulge me for a second, though, I would just like to thank all those in primary care across the NHS working harder than ever to provide support to patients as our response to coronavirus ramps up. Everyone has a part to play in getting through the next few weeks and months. We are rightly proud of how our NHS has and will continue to support anyone affected, but we need to also support them.
Speaker, at a time when the government is rightly committed to increasing GP provision, my constituents and I are deeply concerned that Sandyway surgery in the north of Edinburgh has been earmarked for closure by its practice group. What can my honourable friend or Cheshire CCG do to help the practice improve its overall standard so it can continue to treat its 3,700 patients for many years to come?
I thank my honourable friend. The closure of any GP practice is one that stirs up understandably strong emotions in the local community. The CQC inspection last May highlighted safety concerns at Sandyway surgery, requiring significant investment to bring those premises up to standard. Dambridge Medical Centre have, I believe, consulted and looked at the very difficult decision to close the practice and increase appointments and services at the other two local practices. As ever, I would be happy to meet my honourable friend to discuss how we can ensure Sandyway residents have access.
Mr. Speaker, I noted what the Minister said about GPs and their role in responding to COVID-19, and I entirely agree with her. GPs want to do their very best for their patients. They need quicker access to the protective equipment. They need clear guidance. But will she also lift all the bureaucracy that GPs are currently having to face? I'm talking about appraisals and the quality and outcomes framework end-of-year requirements. Will she suspend those requirements so GPs can focus entirely on responding to coronavirus?
Thank you, Mr. Speaker. I'm currently having those discussions to make sure that we can lift, within the bounds of making sure patients stay safe, all appropriate bureaucracy. And on PPE, we have over 2/3 of PPE now rolled out into GP surgeries, with the rest arriving imminently.
Jonathan Ashworth.
Grateful to the Minister. Many of our constituents, especially those with underlying conditions from emphysema to COPD, diabetes, asthma, will look to GPs for guidance. And when they see what is happening today in Italy, they'll be extremely frightened. What is the government's advice to those with underlying conditions? And can she just tell the House, for the benefit of our constituents, what lessons the government has learned from the Italians on their handling of coronavirus to date and why we are taking a different approach?
So our approach, as we've laid out from the beginning, will be science-led, and it will be about putting the safety of everybody. That's why at some point in the future, doctors will make decisions over clinical judgments, and those with existing comorbidities or more serious sense of the illness will be triaged up into an appointment first. And that may mean that some people have to wait a little longer during this period, but it will always be done on clinical advice, and it will always be done with the safety of the patient at the heart.
Martin Day.
Thank you. Last year, 85% of doctors surveyed by BMA Scotland said that the pension taxation crisis would have significant effect on NHS services, such as waiting times. The government's proposal to raise the taper threshold to 150,000 does not fully solve the problem, and this would cost the Treasury more than reversing their policy. So what is she doing to address this?
Thank you, Mr. Speaker. I'm sure he will understand that my right honourable friend, the Chancellor, might be a little bit upset if I started making announcements from the dispatch box today. It is work in progress. With general practice, it's been a little trickier than it is within the health service, because they don't do specific shifts, which makes it a little trickier to organise.
Martin Day.
Answer. Scotland's Cabinet Secretary for Health, Jane Freeman, wrote to the Chancellor last month calling for a sustainable resolution on the matter in the budget. What assurance can she now offer ahead of tomorrow's budget that the joint review between the Department and the Treasury into the impact of pension taxation on the NHS will produce a long-term solution which will work for all doctors?
I will very gently say I refer the honourable gentleman to the answer I gave a few moments ago.
Speaker, all of the advice given from the Health Department at the moment is to self-isolate and not go and see your GP. But if someone does need to see a medical professional, Can we utilise any of the digital technology that currently exists in the NHS to be able to provide them with the advice they need?
Thank you, Mr. Speaker. Yes, we most definitely can, and many surgeries are actually making sure that digital first is becoming part of their everyday offer to patients across the land. But actually this gives us a real chance to make sure that we both protect the health of the nation and we embrace digital technology to drive access to GPs and their patients further.
Legit Phillips.
Mr. Speaker, for years GP numbers in Sunderland have been falling at a much steeper rate than the rest of the country, and since 2015 we've lost 29 permanent family doctors. Given the major issues we already face around health inequality, when will the Minister get to grips with the worsening situation that we face in Sunderland?
Thank you, Mr. Speaker. We are committed to those extra 6,000 GPs across the country. We have also made sure that we have incentive schemes within areas where it's difficult to recruit, and those have found to be very effective in driving additional GP numbers into areas like her own that has a challenge. We are working on it.
David Davis.
Thank you very much, Mr. Speaker. The UK is a world leader in tackling the global challenge of antimicrobial resistance. Since 2014, we've invested £615 million, and over half of this in R&D, as part of our vision to contain and control AMR by 2040.
David Davis.
Thank you, Mr. Speaker. Regrettably, the coronavirus outbreak has demonstrated the susceptibility of global society to pandemics and antimicrobial resistant organisms. Lord O'Neill, who chaired the review, estimated that some 10 million people a year could die by 2050 because of AMR. And the previous Chief Medical Officer said that we could easily get to a state where fully half of people die from untreatable infectious diseases. So is he content with the level of work and research being done in his own department with respect to novel approaches like genomics, joint drugs, new sorts of vaccination, and will that be reflected, the importance of those things be reflected in the spending review that's coming up?
Yes, absolutely. My right honourable friend is right to highlight the threat of AMR because microbial illness and disease is just as much of a threat as viral disease, and we must make sure that we retain the tools that we currently have through antibiotics to tackle it. We are investing in this space with more to come.
Robert Halfon.
Thank you, Mr. Speaker. I'm hugely grateful. So question 4. Thank you.
Thank you, Mr. Speaker. And with your permission, I'll group this with question 22. We have announced £2.7 billion of funding for 6 new hospital schemes under HIP 1, £100 million of seed funding for a further 21 schemes covering 34 hospitals under HIPs 2, ready to go to the next stage. That is 40 new hospitals in total.
Thank you, Mr. Speaker. My enthusiasm for a new hospital got the better of me. I'm hugely grateful to my right honourable friend, the Secretary of State, for granting Harlow the capital funding for a brand new hospital. Does the Minister not agree that our new hospital will transform patient experience for Harlow residents, the working environment for our brilliant NHS staff, and deliver state-of-the-art healthcare for our town and surrounding villages?
I agree entirely, and I would say to my right honourable friend, I'm looking forward to visiting with him soon.
Thank you, Mr. Speaker. It's thanks to this government that we've got £500 million worth of investment in the Epsom and St Helier NHS Trust, not only to improve the existing hospitals but build a third new one as well. So does the Minister agree with me that this is excellent news for local patients and encourage constituents of mine and surrounding areas to get involved in the consultation on where the new hospital should go?
Quite right. My honourable friend is absolutely right. It is indeed excellent news. As he will be aware, the public consultation process is underway. It would be wrong for me to prejudge that, but I would encourage everyone to participate.
Siobhan Macdon.
Would the Minister agree with me that it's important to spend money well, taxpayers' money well, and to spend it on a site that's going to cost 20% more than St Helier, away from the people with the greatest health needs, is not the best way to spend public money?
Well, I would gently say to the Honourable Lady, as I've said, I'm not going to prejudge the outcome of the consultation. I'm sure she would encourage others to participate. What I would say to her, though, is I'm sure that regardless of that outcome, she would want to welcome the £500 million investment from this government that will benefit her and other communities.
Stephen Balder.
Speaker, during the election campaign, the Prime Minister promised 40 new hospitals, but funding for only 6 has been pledged, £2.7 billion. After more than 5 years of raiding capital budgets, when will the government actually provide the £6.5 billion that's required to fix the maintenance backlog alone? Thank you.
As I've made clear, we have set out the funding for the 6 new hospitals in the first tranche. We have invested seed funding in the development of the schemes for the further 34, and further capital announcements will be made in due course.
Andrew Bowie. Question number 6, Mr. Speaker. Yay. Minister.
Yay. Thank you, Mr. Speaker. With your permission, I will answer question 6 together with question 9. This government will be introducing an Nhs Visa which will offer reduced fees and fast-tracked access for overseas doctors, nurses and allied health professionals to come to work in the UK. My right honourable friend, the Home Secretary, will be outlining detailed plans in due course.
Thank my honourable friend for that answer. In Scotland, we have an increasing GPs shortage crisis and an NHS grampian where £1 million had to be spent on agency nurses this winter. We have an increasing nurses crisis. So there are obviously those that are understandably concerned that the changes in immigration rules will have an adverse effect. Can my honourable friend confirm that the new NHS visa will be applicable in Scotland as well?
Yes, I can absolutely give my honourable friend that assurance. The NHS visa will be available for doctors, nurses and allied health professionals coming to work in the NHS across the whole of the United Kingdom.
Diamond Jupp.
Thank you, Mr. Speaker. As we all know, nurses, midwives, paramedics and physiotherapists are highly skilled roles. The government has been clear these roles do meet the immigration skills threshold. What steps is the department taking to dispel the level of fake news on this subject and encourage the brightest and best from around the world to apply for these important roles?
Thank you. The salary threshold for the roles he mentions for people coming to work in the NHS are linked to NHS pay bands, and applicants will have more than enough points to apply under the new immigration system. We're working with NHS employers to encourage international applicants, and can I thank him for giving me this opportunity to once again dispel any myths about this.
Justin Matters.
Well, I think the Minister's going to have to try a bit harder, because certainly the Chartered Society of Physiotherapists are very concerned that their positions aren't going to be covered, and others, such as care assistants, are also below the salary threshold. And we're talking about absolutely vital roles here, and with 100,000 vacancies across the NHS, will the Minister actually go back to the Home Office and ask them to look at the detail of some of these proposals so they actually don't make the NHS staffing crisis any worse than it already is?
I thank him for his question. I mean, for the NHS, we have the NHS visa in place. There are plans in place to make sure that we have the international recruitment alongside investment in a homegrown workforce and increasing retention and returners to provide the NHS with the staff that it needs.
But we have many skilled health professionals who are in this country, have been granted refugee status and are finding it difficult to get actually accreditation from the regulating bodies. So can I commend to the Minister the Healthcare Overseas programme of Sandwell and West Birmingham Hospital Trust and invite a Minister to come and visit that, but also to have discussions with the regulating bodies to try and speed up the process of enabling these people who've got the skills, want to work, and we need them.
I thank him. So work has already taken place by the regulating bodies, and for instance, we're already seeing speeding up for nurses who want to come from overseas to work in the NHS. I am very happy to have a further correspondence with the honourable member about the specific problem, and would be delighted if he could send me an invitation to make the visit he's mentioned.
Thank you, Mr. Speaker. Can I congratulate the Department on securing this NHS visa?
but as the Minister knows, it does not apply to nurses and care workers in the social care sector. What is the Department's assessment of the gap there will be in the social care workforce as a result of this new immigration policy, and how are discussions going with the Home Office and Number 10 on that issue?
I thank my right honourable friend for his question. I am well aware of concerns in the social care sector, particularly in areas where there are vacancy rates. It's important that employers make sure that they are taking the steps that they can take to make sure that social care jobs are attractive and, of course, should be well paid. I recognise as well a role for government in this, supporting the role of working in social care and overall making sure we come together and fix the social care crisis.
Jim Sharp.
Question number 7.
NHS England outlined the Care for Young Carers offer in GP surgeries in June 2019. This offer includes a package of practical plans and actions to help young carers, and the uptake will be monitored at a regional level in England through integrated care systems.
Jim Shannon.
A response, but can the Minister further break down the number of surgeries that have offered priority appointments for carers, for home visits, for additional mental health checks, and double appointments for the care and those they provide for? And what is the Minister doing to see this rolled out in every GP surgery throughout the nation, bearing in mind that 40% of carers struggle with their own mental health?
My honourable friend makes a really important point about support for carers and young carers. I can't answer the details of his question right now, but I will take it away and talk to the Minister for Primary Care and also the Minister responsible for mental health and come up with a better answer for him.
Daddy.
Number 10, Mr. Speaker.
Thank you very much, Mr. Speaker. The systems that we have in place are already securing access to effective new medicines for many thousands of NHS patients, for instance, cystic fibrosis patients, through the drug Orkambi. Our commitment to getting new drugs into the NHS through an innovative medicines fund will further expand access to medicines for NHS patients.
Thank you, Mr. Speaker. My right honourable friend is aware that 2 children in my constituencies have families who are self-funding the cannabis-based drug Bedrolite, which is their only means of controlling their severe epilepsy. The Secretary of State has very kindly agreed to meet with me to discuss their case, but can I ask what action is being taken to make Bedrolite available on the NHS for those families, like the 2 in my constituency, who this really is the last resort?
My honourable friend is right to raise this case, and I look forward to meeting him later this month on this issue. And these are desperately difficult cases, and we've got to trust doctors to make the correct clinical decisions for each individual patient. 2 licensed cannabis-based medicines have recently been made available for prescribing on the NHS. And we keep working hard with the health system, with industry and researchers to improve the evidence base, and also the costs need to be brought down by industry. My honourable friend, the Minister, held a roundtable last week with leading industry figures, and I look forward to continued work to make sure that we can get these drugs to the people who need them.
Speaker, women suffering from endometriosis do often not get the medicine or treatment they need. 1 in 10 women suffer from this condition, and it takes on average 7 years to have a diagnosis. Will the Secretary of State please meet with me and the APPG for endometriosis to discuss how we can develop research into this condition and look at the work being done at Hull University?
Yes, I'm very happy to look at that research and for either me or the Minister to meet with her and those who she represents through the APPG. This is, of course, a very important issue. I think, frankly, it has been under-discussed for too long and should be brought up in the agenda.
Peterborough is the UK's 4th fastest growing city, home to over 200,000 people. And our hospital serves many, many more. But despite this, Peterborough and Fenland patients are forced to travel to Cambridge or further for percutaneous coronary interventions or PCI and other cardiac medicines to treat or prevent heart attacks. Will my right honourable friends support my ambition and of those at the Trust to ensure that there will be an elective PCI and other medicine service, cardiac service at Peterborough City Hospital?
I'm very happy to look into this individual case and either to meet him or the Minister meet him to see what we can do.
All right. Question number 11, Mr Speaker.
With your permission, Mr Speaker, I will answer question 11 together with question 23. The points-based immigration system is designed so that the UK can attract the brightest and best individuals to work here. As the honourable member no doubt knows, jobs where there is a recognised shortage of supply, such as nurses, are on the shortage occupation list, and people filling these roles will score more than enough points to come to the UK. We're also introducing the Nhs Visa to make it easier for doctors and nurses and health professionals from all around the world to come to work here.
Brenda O'Hara.
The sector is understandably worried about what a points-based system will mean for their ability to recruit the workforce they need. Soon I plan to reintroduce my private member's bill, which sought an independent review of the impact of Brexit in the sector, but also now to include an independent evaluation of having such a points-based system. Given the importance of an evidence-based approach to policy making, will the Minister agree to meet with me and others to see how we can all work together to ensure that the long-term needs of the health and social care sector are met based on the evidence available?
I thank the honourable member for his question. I am in contact with stakeholders as a relatively new minister in this post, reaching out as much as I can. And I'm mindful about concerns about vacancy levels, but absolutely committed to make sure that both across health and social care we have the workforce that we need.
Mr Speaker, not only does this government treat the Scottish Government with contempt, but they treat their own Scottish Tory colleagues in the same way, as they were reportedly livid about the points-based immigration system introduced. Given the implications for the health and social care staffing in Scotland, will she ask Cabinet colleagues to reconsider our proposals for a Scottish visa?
So we have the Nhs Visa, which applies to the whole of the United Kingdom. I should say also that the Migration Advisory Commission has been clear that UK immigration policy must benefit the whole of the UK, and Scotland benefits from its own shortage occupation list, which will continue to exist.
Does my honourable friend agree that a German-style system of social insurance for adult social care would relieve the burden and reduce the requirement for overseas workers by allowing a loved one, a neighbour or a friend to provide that care and be properly remunerated for that care?
I am well aware that my honourable friend is very keen on this particular approach. He should hopefully have received the letter from the Secretary of State inviting colleagues to come and talk to us about the proposals and options for fixing our social care crisis, and I hope he will take this up.
Dr. Luke Evans.
Thank you, Mr Speaker. Would the Minister consider waiving the NHS surcharge to overseas staff that may want to come and work in our NHS?
I am well aware about some concerns about the surcharge. Can I say that for many overseas nurses coming to work in the NHS, they don't have to pay the surcharge, as that is covered by their employer?
Thank you, Mr Speaker. The phrase brightest and best, when it appears within immigration talk, is obviously subjective and is sort of deliberately vague. What both private sector and local authorities want to know is, will they be able to get the people coming in who want to care, we're desperate for, will they actually be able to come under the new government system?
I should say that for the NHS, we have the Nhs Visa and a clear route to come and work in the health sector. For social care, there's a job to be done by employers to make sure that working in social care is an attractive job which is well paid, and I also recognise a role for government and actually for all of us in Parliament to come together and support changes to how we pay for and how we fund social care. We need to fix the social care system for the future.
Dr. Kieran Millen.
Number 12, please, Mr Speaker.
I don't have 11 minutes. Mr Speaker. We are currently considering all options to allow... Even better. I'd be extremely grateful if we could group this possibly with number 18, Mr Speaker. Thank you very much. I'm very glad. We are currently considering all options to increase the range of healthcare professionals permitted to administer low-risk medicines. This is all a part of making sure our NHS workforce is as flexible as possible, and we will do this in light of what can be done, of course, keeping a highlight on patient safety.
Speaker, my constituent Jessica Raw works as an operating department practitioner in Leighton Hospital, and her and her colleagues make a huge contribution to patient care. Would the Secretary of State agree to meet with Jessica and other ODPs to hear their case for why allowing them to prescribe would allow them to enhance the care they provide for patients even further?
Yes, of course. I'd be very happy to meet with my honourable friend and with those who he represents to make sure that we can get the right balance between the maximum possible flexibility, subject, of course, to patient safety.
Joe Gideon.
Thank you, Mr. Speaker. Would my right honourable friend join me in welcoming the government's commitment to an extra 26,000 primary care staff and confirm that this will improve access to primary care services for my constituents in Stoke-on-Trent Central?
Yes, the 26,000 extra staff, as well as the extra GPs in primary care, is going to improve. But also, we're taking steps, of course, to improve access, as she asked about, by making sure that people can access primary care in the best possible way. And I can be clear to the House today that we will take a digital-first approach to accessing primary care and outpatient appointments, so that wherever clinically and practically possible, people can access and should access access to primary care through phones and digital means. This is especially important in the current coronavirus outbreak. Already there is a rollout that started, but we will make this across the country with immediate effect.
We've been waiting for a year for the Greenwich Clinical Commissioning Group to reopen a nurse-led practitioner drop-in centre on the Horn Park estate. This was a place where people from that local community could pop in, get minor treatments, but also vaccinations, and they could prescribe low-risk drugs. Can I commend this service to the Secretary of State? Can he assist me in urging Greenwich CCG to reopen it as quickly as possible, but also look at it as a possible model for other areas?
Yes.
Abena Apong Asari.
Thank you, Mr. Speaker. Question 13.
Thank you, Mr. Speaker. 1.5 million more people with suspected cancer were seen by a specialist last year compared to the numbers in 2010, thanks to our dedicated workforce. We want to go further and diagnose 3/4 of all cancers early, more if possible. I am grateful to those charities, particularly ovarian charities, who are raising awareness this particular month for cancers like ovarian, where symptoms are vague and can be harder to detect. It's more difficult. To achieve the ambition, we are radically overhauling screening to improve access to uptake and investing 200 million in diagnostic equipment.
Abena Apong Asari.
Thank you, Mr. Speaker. What is the Minister doing to ensure that all women that are diagnosed or have ovarian cancer is ruled out within 28 days, in line with the faster diagnosis standard?
Yeah, well done. Thank you, Mr. Speaker. Under the long-term plan, we are rolling out those rapid diagnostic centres, giving GPs another important route into patients, and with the Mike Richards screening review, making sure that we get patients to the clinicians where they need to go so they can access treatment faster. With cancer in particular, it's more important than anything else that we get cancer early so we can treat it well and give people a real chance of a long life.
Mr. Carmichael.
Number 14, Mr. Speaker.
Thank you, Mr. Speaker. Cancer survival, as I say, is our priority, and that was made clear in the long-term plan. Unlike many cancers, we haven't moved the dial really far enough for patients with brain cancer. To ensure better outcomes for those affected by brain tumour, we need to focus and redouble our efforts into innovative research and new methods of diagnosis and treatment. It's why we've pledged 40 million over 5 years to stimulate brain tumour research, working alongside the Tessa Jowell Brain Cancer.
That's welcome news, Mr. Speaker.
10% of all cancer deaths amongst people under 50 are from brain tumours, but still, as a cancer, it receives only 2% of the money spent on cancer research funding. The previous government established an inquiry into this and to see what more could be done. Does the Minister agree that this month, actually Brain Tumour Awareness Month, would be a good time to re-establish that inquiry?
I would be more than happy to meet with the gentleman and talk about his ambitions. The funding is going up, and as I said before, all cancer charities who just drive awareness so people are more aware of the symptoms, particularly with some of those where we're really not moving forward fast enough, is always welcome to me.
Sherman. Question number 15, Mr. Speaker.
Again. Thank you, Mr. Speaker. I strongly urge all parents to ensure that they vaccinate their children. Public Health England and NHS are implementing actions from the Measles and Rubella UK elimination strategy designed to increase the take-up of the MMR vaccination in children, adolescents and adults. This includes providing additional opportunities to catch up on missed vaccines and improve information to the public that emphasises the importance of getting the MMR vaccination.
Mr. Speaker, I hear what the Minister says, but is she aware that, of course, all of our thoughts are on coronavirus at the moment, but is she aware that last year 140,000 people, mainly children and young people, died from measles? And the measles epidemic is going to come here as the rate of protection for getting the MMR vaccine decreases. This is a real issue. Could she join my campaign to make sure every child that goes into early preschool care and early care and early school has a certificate that says they've had the MMR?
I would love to meet with the gentleman and talk about his campaign, because actually the government is looking at any way that we can improve vaccination rates. Vaccinations work on protecting the herd, and actually losing the WHO status on measles last year was very sad, and it is something that we should all be mindful of and make sure that we all look to helping people access MMR vaccines for their children.
Question number 17, Mr. Speaker.
Thank you, Mr. Speaker. My honourable friend is a strong advocate for Cromer Hospital, and although it is relatively new, as for example the area's 2015 cancer strategy showed, they projected a 200% increase in the need for cancer care over the next 10 years. So last year we saw the start of the £4.15 million proposal for a new cancer centre at Cromer in partnership with Macmillan, but I know he and his trust are more ambitious than that.
Duncan Baker. Thank the Minister for that answer. North Norfolk is one of the oldest constituencies by demographics. It's very rural, and it is a long, long way from the Norfolk and Norwich Hospital. What I'm really looking for is an enhanced urgent treatment centre with mental health facilities. That would really help my constituency, and not only that, it will take the pressure off the Norfolk and Norwich Hospital. Would you support my campaign for more improvements there, please?
Well, my honourable friend is right to highlight, for example, I think his constituency has the highest average age in this country, and as an assiduous reader of the Eastern Daily Press, I saw recently the story outlining their plans, or the Trust plans for UTC. I look forward to seeing those proposals develop further, and what I would say is that the key to delivering them, or making them make progress, will be partnership. And I look forward to the Hospital Trust, him and the CCG working in partnership to deliver an outcome.
Question 19, Mr. Speaker.
Thank you very much, Mr. Speaker. Life expectancy at birth is the highest it's ever been. Figures this week showed last year mortality was the lowest since 2001. But we are not complacent. Already, we've made clear our bold commitment to level up left-behind areas.
Thank you, Mr. Speaker. The truth is, if you live in poverty, you'll get ill quicker and you'll die sooner. For my constituents in Fairhouse Ward in Fleetwood, life expectancy is 10 years shorter than just 5 miles down the road in Carlton. And with the report out last week, we know that life expectancy has stalled, and for the poorest women, it's actually now declining. What kind of damning verdict does the Minister think that is on his government's 10 years of Tory cuts and austerity?
Well, I agreed with most of what she said, and the starting point in particular, that the gaps in healthy life expectancy are far too big, and she will have heard me to articulate from this dispatch box how important it is that we close those gaps. The news out, though, this week of lower mortality in 2019 was good news, which she ought to welcome, but it certainly doesn't mean that this campaign to close the gap in healthy life expectancy is over. There's far more to come.
Coronavirus, of course, does have a bearing on the question of life expectancy. I have a particular concern in relation to GPs in surgeries in my constituency. A world leader in the transmission of infections has raised with me a vital question, which is the provision of protective suits and training, because at the moment it's not being given to GPs, I'm told. It's being given more exclusively to hospital staff. Would you please look into that and do something about it?
I'm right across this issue, and he's right to raise it, but I can reassure him fully that we now have rolled out PPE to 2/3 of primary care, and the rest of it is in progress. So we will absolutely address this. It's quite right that we did. We wanted to get the timing of the rollout right so that the equipment is there should this epidemic hit in a very large way. We've got to make sure we protect our health staff.
Number 20, Mr. Speaker.
Thank you, Mr. Speaker. Despite the NHS seeing a substantial rise in demand, with 1 million more attendances at A&E in 2019 than 2018, our NHS staff, our amazing NHS staff, continue to work hard to ensure everyone gets the care they need, including seeing 1.7 million more people within the 4-hour standard than in 2010.
Mr. Speaker, this morning as I scanned the NHS England winter situation reports covering Barking, Havering and Redbridge University Trust in my constituency, I saw it massively underperformed in terms of ambulance handover delays. Across this winter, they in fact averaged 38% in terms of average handovers involving delay of at least 30 minutes. The national average was just 14%. So, Mr. Speaker, I'd like to know from the government how they explain that despite trusts seeing 16,000 fewer arrivals this winter, there were 22,000 more handover delays.
Well, I would say to the honourable gentleman that he will know that the London Ambulance Services service the whole of London. His trust does see increased demand, increased challenges associated with winter. But I would also point out the positive to him, that his trust received £1.2 million of winter capital in 2018 to aid preparations for winter, and also in the 20 hospital upgrades programmes, he will know that the St George's site, serving the Trust more broadly, is included in that for a health and wellbeing centre, which will ease pressures.
Questions, Emma Callaghan.
Thank you very much, Mr. Speaker. The global coronavirus outbreak is clearly growing. Last night, Italy placed the whole country into quarantine. We've updated our travel advice to advise against all but essential travel to Italy. All those returning from any area of Italy must self-isolate for 14 days. This is in addition to our advice that anyone who visited the specific areas of northern Italy, which were originally locked down in the past 2 weeks, should self-isolate for 14 days. We will do everything we can to keep people safe based on the very best scientific advice.
Thank you, Mr. Speaker. A recent survey by Teenage Cancer Trust found that 29% of young people who were treated for cancer did not have a discussion about their fertility with a healthcare professional, and of those who did, 44% were not satisfied with that discussion. Will the Secretary of State meet with me and representatives of Teenage Cancer Trust to work towards some much-needed progress in ensuring young people and their families that fertility is of extreme importance?
I know that the Honourable Lady has personal experience in this area. I entirely understand the concern that she's raised. The personal plans that are being brought out from next year should help to address this problem, but my honourable friend, the Minister, is very happy to meet her to make sure that we get this exactly right.
Gareth Davis.
Thank you, Mr. Speaker. Over 3.5 years ago, Grantham Hospital was closed overnight owing to temporary measures. This has gone on for far too long. Enough is enough.
can the Secretary of State help me and offer any guidance or update on what we can do to get those doors back open 24 hours a day?
Thank you, Mr. Speaker. It is vital that the people of Grantham are able to access 24-hour care for both accident and emergency and urgent treatment needs. I'd urge my honourable friend to continue to work with his local health services and commissioners to develop plans to ensure the needs of his constituents are met. I know he's already been a strong advocate on this matter for his constituents in this House since his election, but I am, of course, very happy to visit him in Grantham if that would be helpful to him.
Thank you, Mr. Speaker. Personal protective equipment can be as important in social care settings as it is in hospital or GP settings, but care staff report having to buy their own gloves, and one care provider had their order of protective equipment requisitioned by the NHS. The Secretary of State says he's all over this issue, so what plans does he have to ensure that care staff have access to protective equipment to protect them and the people they care for?
Of course, care staff too are absolutely vital in the national effort to address coronavirus, not least because of the increased risk of many people who are in both residential settings and also who receive domiciliary care. The work to make sure that protective equipment is available extends to social care staff. Of course, most social care is provided through private businesses, and therefore it is a different delivery model, but it doesn't make it any less important. And I'm very happy for her and the Minister for Care to have a meeting to make sure that we can listen to the concerns that she's heard, because of course we want to address them.
Thank you, Mr. Speaker, again. Workforce vacancies. There are already 120,000 vacancies in the care workforce, and we're now facing the prospect of large numbers of care staff having to self-isolate because of coronavirus. With the NHS also needing staff, which we've discussed already today, what plans does the Secretary of State have to ensure that care providers are still able to fulfil their contracts and provide their clients with support?
Well, this is also an incredibly important issue that we have, that we're considering and that we're working on, and that we will make sure that we address any barriers there are to social care operating. Now, in all contingency plans on the reasonable worst case scenario, plans are needed for being able to operate with a 20% reduction in workforce, but making sure that the best care can be provided in what is going to be a difficult time for social care is a really important part of the effort that we're working on.
Rundle. Thank you, Mr. Speaker. The Medicines and Medical Devices Safety Review into, amongst other things, vaginal mesh implants. The then Health Secretary described the response to these tragedies as not good enough. Can my right honourable friend assure me that those women who now need mesh removal are receiving all the support that they need and that adequate resources are in place for the treatment they require?
He's quite right to raise this. It is true that the scandal over mesh is something that the NHS has had to rise to address. There's a lot of work still to be done.
Toby Perkins. Thank you, Mr. Speaker. The Secretary of State is absolutely right to say we need to take advantage of all medical evidence, and in that light, isn't it deeply damaging for the Prime Minister to go on morning television and start musing about the idea that we might have a theory of just letting coronavirus have its bout out and see how it goes? Doesn't that absolutely fly in the face of the efforts that he's making? Can he clarify that that isn't the policy of this government and tell us what the hell the Prime Minister was talking about?
No, the honourable gentleman is wrong to raise this issue in this way. It was addressed in the House yesterday, actually. The Prime Minister was explaining that that is not government policy.
Thank you, Mr. Speaker. Loneliness will affect most of us during our lifetime. It can define our lives and have a significant impact on our health and well-being, as well as increasing pressure and costs on our health services. There are some brilliant voluntary health support services to combat loneliness. So can the Secretary of State advise me on what plans he has to join up the NHS, health and social care and our voluntary support sector to provide the best possible care for victims of loneliness? Minister.
My honourable friend is right about loneliness, both how widespread it is and the costs. The cross-government loneliness strategy does indeed join up the voluntary sector and many parts of government, led by the brilliant Baroness Barron in DCMS. On our part, in this department, we are supporting particularly the growth of social prescribing, which enables GPs to direct their patients to a host of activities, many of which help people overcome loneliness.
Mr. Speaker, trying to keep a sense of perspective, last weekend government sources indicated that the worst case scenario would be 100,000 deaths due to the current virus outbreak. Given that China has reported just over 3,000 deaths and they've been at the epicentre of the virus for 10 weeks but have a population 20 times greater than the United Kingdom, was the 100,000 figure a helpful reference?
Well, of course we have to plan for a reasonable worst-case scenario, but we're working incredibly hard to avoid that scenario. The Chinese government undertook some very, very significant actions, and what is not yet clear is whether the impact of the actions that they took was to slow the spread such that when those actions are lifted, the spread continues, or whether the virus has in effect already gone through the population of Hubei. We do not yet know that, and therefore it is not yet possible to interpret the epidemiological consequences of the deaths figure in China.
Thank you, Mr. Speaker. Last Friday I held an open meeting so that my residents could better understand the proposals for Epsom St Helier Trust. Whilst I understand the Minister can't comment on the consultation, doesn't he agree with me that my residents would be better to consider the evidence which shows these proposals will improve access, improve quality and have no adverse impact on health inequalities?
I'd say to my honourable friend he is absolutely right. While I don't intend to prejudge the consultation, I would say exactly what he has done, that his constituents should look very carefully at the evidence, what it will do to save lives, to improve healthcare and respond accordingly.
Thank you, Mr. Speaker. The Secretary of State confirmed in response to an urgent question from the Shadow Health Secretary yesterday that emergency legislation that is being brought forward to tackle the coronavirus will include changes to statutory sick pay. Can he confirm to the House that specific proposals will be included in the emergency legislation to remove the lower earnings limit of £118 per week in order to provide access to statutory sick pay for 1.8 million low-paid workers?
I can confirm that we will ensure that whatever the status of people who work right across the economy, whether they're self-employed, whether they are employed but work fewer than the number of hours a week, everybody will ensure that they can get the support so they're not penalised for doing the right thing.
Siobhan Bell.
Thank you, Mr. Speaker. Workforce pressures are rightly on the agenda at the moment, and we hear a lot about recruiting internationally, but I want to hear more about what we're doing to promote homegrown workforce, training, lifelong learning, and getting people to enter the health profession at any time of life.
Can I thank my honourable friend for her question? Indeed, today there's been much discussion of international recruitment, but alongside international recruitment, we're absolutely committed to boosting our homegrown workforce. That's particularly to achieve our ambition of an extra 50,000 nurses in the NHS and 6,000 more GPs.
Speaker, at a time when the NHS is under pressure as never before because of coronavirus, does the Secretary of State agree with me that to close Mildmay Hospital in my constituency would be an act of unbelievable folly? It provides patients with a specialist unit for HIV/AIDS, and to force those patients into the mainstream would endanger lives. So can he commit today to providing the much-needed additional funding of £5 million a year to save this very important hospital doing very important work?
I'm grateful to the Honourable Lady. I welcome, as I'm sure we all would, the huge advantages in HIV and AIDS care and treatment in recent years. She and her trust came to see me recently to discuss this case. Following that meeting, I understand NHS England and the CCG and others have met with the trust to have discussions about the issue and the way forward. That is the right forum to do that and to find the right way forward. A way forward, though, driven by the clinical evidence of the right approach.
Speaker. In Windsor we have an ageing but distinguished population, and we recognise that adult social care is one of the biggest challenges facing the country and local authorities. May I thank the Secretary of State for his dedication to resolving these issues with the Better Care Fund allocation, but also with his call for input from MPs, among others. Does he have an open mind to the concept of a precept for adult social care for local authorities during those discussions?
I thank him for his question. He'll be aware that already some of the funding that adult social care receives can be through a council tax precept. But I was delighted to meet with him as part of the cross-party talks that we have initiated to address the challenges in social care.
Honora Wilson.
Mr. Speaker, there are numerous reports of people with symptoms of coronavirus who are being refused a test by 111 because they can't name an individual who's been diagnosed with the virus. His ministerial colleague yesterday, the Noble Lord Bethell, said there must be people who've had a bad experience in reference to 111. Could the Secretary of State confirm whether it is indeed policy not to test those with symptoms who can't be contact traced, or whether many people are simply having a bad 111 experience?
Protocols in 111 are, of course, driven by the clinicians. I'll look into the specifics of the case that she mentions that was raised in the other place yesterday. We keep those protocols, though, under constant review, not least as the epidemiology of this virus